And now a moment from Your History and Health starts first with Dr. Richard Brown.
Hello, I'm Dr. Richard Brown, and I want to welcome you to Your History and Health Comes First. Thank you for joining us for this week's podcast. It is January 26, 2022, and we're only 1 week away from Black History Month, which we know is the shortest month in the year, but we're going to celebrate it to its full extent every single day. So we continue to struggle with the issues from 2021, which is health disparities as we deal with every day, as well as the coronavirus, which is with us now. There's still issues with that. It's still mutating. Its job is to mutate and to keep doing what it does to infect people. And our job should be to do all that we can do to make sure that the virus doesn't survive and that we and all of our people live. So I just want to say that everyone should be mindful of that and continue to do what's necessary to get that vaccine and to use all the safety precautions that needs to be used to keep from spreading the virus. So my topic for this week is entitled African American Contribution to Medicine and Healthcare. And this is part one. There's a lot of information, and so I think I'll have to break this up into two parts, but let me get started. So I'm going to go through and trace the history of African Americans and their health professions from the first time that they were enslaved as Africans and touched their foot down on the shores of Virginia back in 1619. So let me begin by saying that we know that the Africans were brought here in slave ships. Some people may say, well, how do you keep talking about that? Well, it's significant because it affects us today. But when you look at people that have laid in the bottom of a slave ship for 2 or 3 months to come to these shores, that alone means that they endured some serious suffering, and only the strongest survived. And so every African American that is here now that came through that transition represents the strongest and the best of us. And so we should be able to continue to endure whatever comes before us. But we've had some serious challenges and still do. So Americans' history and background, I want to start here in 1776, where we had the Declaration of Independence. But before we got to that, 1619, and there's a book entitled 1619, which is a very good book, 500 pages that I encourage everyone to read. It's a tremendous account of the true history that we don't know about and haven't been taught. But the first Africans arrived in America in 1619, and they came to the state of Virginia. That's 402 years ago. So in 1861 to 1865, we had the Civil War between the North and the South, and it was about slavery, of course. There was 600 people died. That's a rough estimate. The North and the South were fighting against each other because the South wanted to keep slaves and enslave people because it was good for their economics and their lifestyle, and the North wanted to change this, and they wanted to have a democratic government without slavery. And so we fought a civil war from 1861 to 1865. So this lasted for about 4 years. Well, we know that the North won, but the South lost, but they never gave up, and they're still fighting against and for those things that perpetuate their thinking and their lifestyle and the policies that they wanted to keep in place. So in 1865, okay, after the Civil War, there came an era called the Jim Crow era, and where Jim Crow laws were implemented. And these were implemented in the South for the most part, but they also spread to the North. These Jim Crow laws had to do with keeping African Americans and these newly freed slave people in slavery continuous. Even though the law had changed, they had lost the war, they continued to restrict where African Americans could travel. They restrict their employment. They restricted them from having any kind of semblance of existence without being dependent upon the landowners and the plantation owners. So in 1866, 1 year after the Civil War was over, there came into existence the KKK, which was established in Tennessee by the Confederate veterans. In 1867, it's called the Reconstruction period, and the act was developed and created in 1867. And this was designed to help former slaves to gain some political positions and aspirations and power, and to help them with their education and their economic power. And so one of the things they decided to do is, well, let's give them 40 acres and a mule. This was the level of, I guess, economic security and power that existed back then. It was an agricultural community. And so that was what was decided. General Sherman was a proponent of this, but of course it didn't last. Matter of fact, very few, if any, got their 40 acres and a mule because the politics changed and other people got in power, and they decided that, nope, we're not going to do that for these newly freed slaves. So in 1870, there was the 15th Amendment, which gave Blacks the right to vote. So before that, we did not have the right to vote. This gave them the right to vote. And in 1954, there was the Brown versus Board of Education, which prohibited segregation in public schools. So before that time, Blacks were not allowed to go to school with whites. Whites could not go to school in Black communities. But the Brown versus Board of Education prohibited segregation. And so that was some progress. And in 1964, the year that I graduated from high school, the Civil Rights Act was passed to make voting easier for African Americans. 1965, Voting Rights Act was passed, and the limitations on African American voting rights was stopped, supposedly. However, we know now that in 2022, there's been laws that are being passed, and I think there's about 32 states that have passed laws that make it more difficult for people, and specifically African Americans, to vote. And so the South and others in the North and people in general who are against civil rights and the rights of African Americans are still fighting that war and doing everything they can to hold African Americans back. So there's a person by the name of Carter Godwin Woodson, born December 19th, 1875. He died in 1950. He was an American historian. He was an author. He was a journalist, and he founded the Association of the Study of African American Life and History. And he was one of the first scholars to study African American history. Before that, there was not any studies on African American history, and not much written that the mainstream community education systems and programs used at all. So he founded a journal that was called the Journal of Negro History. And he has been identified as the father of Black history. He launched the celebration of Negro History Week in February 1926. It was only a week back then, and now it has gotten to be a month. And for a lot of African Americans I know, we try and celebrate African American life and history every day. So Goodson was a son of a former slave, but he earned a PhD in history from Harvard University in 1912. He discovered that American history ignored and left out African American history by scholars. And we know now that a lot of the history of African Americans is still being left out. There are laws being passed to restrict, and specifically, I'm thinking about Florida, Governor DeSantis, who's trying to pass a law that says that he does not want white people to feel uncomfortable by teaching them about slavery and about the history of African Americans and the history of this country and how it came about. He says that he doesn't want white people to be uncomfortable, doesn't want children and young people to be uncomfortable. Well, we know that African Americans and other minorities are uncomfortable every single day. Where we live, where we go to school, where we work, where we vote, we're always uncomfortable because there's a cloud of racism that still exists in this country. So I'm going to go into now talking about the medical practitioners that came through all of this turmoil and evilness that was perpetuated in this country on African Americans. Now, the first practitioners were untrained, meaning that they did not go to medical school, but they were medical practitioners. They did healing. They practiced medicine and healed people and kept people from getting sick and helped people get well who were sick. So the first of them were untrained. So the medical practitioners that were untrained, there were several of them. There was one by the name of Onesimus, 1721. He was a Boston slave, and he introduced the science of preventive medicine. The science of preventive medicine, which we've just heard about in the last probably 15, 20 years as a mainstream concept. He introduced that way back in the 1700s. He advised his master to inject materials from a smallpox victim into the blood of a non-infected person to prevent the recipient from contracting the disease. It was successful, and the technique was learned in Africa when he was a boy because they did some inoculations over there. So we know now that the vaccines many of the vaccines that were used previously, not so much now, especially with the coronavirus, were developed by taking a diluted portion of the disease and placing it into a vaccine and introducing it into the body of humans in order to cause the body's system to begin to develop antibodies against the disease that they're afflicted with. And this is smallpox, measles, mumps, and some others. But Onesimus was the first African slave who introduced this concept in Boston to them when they were fighting smallpox. Second is James Durham. James Durham, 1762. He was an ex-slave born in Philadelphia, and he acquired his medical skills while he was a slave from his owners. There was a physician who was a British Army surgeon, and he owned James Durham, and they lived in New Orleans. And so James was fluent in English, French, and Spanish, and he practiced many years in the Gulf Coast of in the Gulf Coast, along the coast of the Gulf. David Ruggles is another person, 1810 to 1849. He was born free, and he was a hydropathic physician who built the first building in Massachusetts in the United States that was dedicated exclusively to hydropathic medicine. Another untrained physician, practitioner, was William Wells Brown. He lived from 1816 to 1868. He was born in Kentucky. His mother was a slave, and his father was white, slave owner. He escaped and went to Ohio when he was 18 years old, and eventually he began to practice medicine in Boston and did so for many years. Another untrained practitioner was Martin Delaney. He lived from 1812 to 1885. He was born free, but he lived in West Virginia, and he grew up in Pennsylvania. And he became an abolitionist, as well as a colleague of the famous Frederick Douglass. So he was admitted to Harvard and went to school for a good while, but later he was dismissed at some point because of some reasons that we don't know exactly, but you could probably speculate. But anyway, he went on to practice medicine many, many years, even though he didn't complete his medical education from Howard. And he was honored for his work in the cholera epidemic in 1854. Okay, now I want to turn to those practitioners, medical practitioners who got trained. So James McCune Smith, he was born in April 1813. He was an African-American. He was a physician, and he was an apothecary and an abolitionist, and he was the author in New York City. He was the first African-American to hold a medical degree and graduated at the top of his class at the University of Glasgow in Scotland. So he went to Scotland because they wouldn't allow him into the medical schools here in the US. Wouldn't allow Black people to go to medical school back then. But in 1865, he was able to get that done, graduated from Glasgow University in Scotland. And he came back to the United States, and he became the first African-American to run a pharmacy in the nation. The next formally trained practitioner was John Swett Rock. He lived from 1825 to 1866. So he was born in New Jersey, and his doctorate was conferred by the American College of Philadelphia in 1852. And he practiced in Boston. He became the first of his race to be admitted to practice law before the US Supreme Court. Next, we have the first woman, who is Rebecca Lee. She was a graduate of the New England Female Medical College. She was in the class of 1864, and she was the first female African-American to be awarded an MD degree. 1864. Now, we were freed. The war was went until 1865, but she was able to because she was up north and where African Americans was free to go to medical school and graduated in the class of 1864. The second formally trained female African American physician was Dr. Rebecca Cole. So she lived from 1846 to 1922. She received her medical education at Women's Medical College of Pennsylvania. And in 1869, she provided professional services for more than 50 years in Philadelphia. She also practiced in Columbia, South Carolina, and in Washington, D.C. The next female person that was trained medically was Susan Maria Smith. Susan Maria Smith, she lived from 1847 to 1918. She became the third African-American woman to be awarded an MD degree. Her degrees were conferred by the New York Medical College for Women, where she was valedictorian of her class. She practiced in Brooklyn for 24 years. So we know that African-Americans were smart, have been smart, are smart, and have the capabilities of performing anything that anybody else can perform. And this history is important to know because lots of people don't know that. African Americans don't know this history. White Americans don't know this history. And so they view us from the perspective that they have, which is vacant of true history. It's fragmented. And for the most part, there's a lot of untruth in where they're coming from. So now let's go to the dental practitioners that were the first. So Robert Tanner Freeman, he lived from 1846 to 1873. He was born in Washington, D.C., and his ex-slave parents took the name of Freeman after being freed from bondage. So his name is Robert Tanner Freeman. So if you see any Black people whose name is Freeman, you might think back and say, okay, this person is a direct descendant of at least one plantation whose the owner name was Freeman. And so the slave, once they got free, they took the owner's name as Freeman. And so that's as far as the origin goes for people named Freeman, unless they begin to trace back to Africa or probably Africa or the West Indies, but then it would be a different name. It certainly wouldn't be Freeman. So he learned dentistry from a white dentist named Dr. Noble. And along with his classmate, George Franklin Grant, they graduated from Harvard in 1867 and became the first African-American dentist in the United States. So the National Dental Association was formed in 1907. And so they named their dental society after him for his extended mission and his expanded dental treatment to impoverished people. And he practiced with those who were disabled and people of color and people of all ages. Now, the first dental female practitioner was Ida Gray Nelson. Ida Gray Nelson Rollins, she lived from 1863 to 1953. She was born in Cincinnati, Ohio, and she became the first female African-American dentist. That's Ida Gray Nelson. She graduated from the University of Michigan College of Dentistry in 1890. She practiced in an African-American neighborhood of Chicago, but later she treated all races. And actually one of her patients became the second female American dentist who lived in Chicago. So we've gone from medical practitioners that were untrained to medical practitioners that were trained to dental practitioners that were trained. And now I want to go to the nursing practitioners. So Mary Elizabeth Mahoney, she was an RN. She was born in Massachusetts in 1845. And she changed the course of American nursing forever when she became the first professionally trained African-American nurse in 1879. She was the first African-American nurse who worked in the United States. She attended the New England Hospital for Women and Children Nursing School. Now I want to move to schools and professional associations. So after the Civil War, which I spoke of earlier, between 1868 and 1907, there was a total of 14 trained schools organized. These were medical schools. There were 14 medical schools that were developed in the United States, and they were organized, and Black folk were getting trained in medicine. All but 2 of these were located in the South, and 6 were in the state of Tennessee. 6 of these medical schools was in the state of Tennessee. Not sure exactly why that occurred, but that's the data, that's the history. And the first was in Washington, D.C. at Howard University, which was founded in 1868. In 1870, the second was announced medical school, and that was at Lincoln University at Oxford, Pennsylvania, but it closed 2 years later. The third medical school was Straight University Medical Department, established in 1873 in New Orleans, Louisiana. And then we had Meharry Medical College, which evolved as the out of the medical department of Central Tennessee College in Nashville in 1876. So we had a lot going on in terms of medical schools and African Americans becoming physicians and practitioners. And then came along something called the Abraham Flexor Report. 1910, this is on the minds of anybody who has studied medicine and who have studied medical schools, know about the Flexor Report, and those who study public health. So the Abraham Flexor Report, 1910, reported on medical education. And as they did their reports, they determined that these medical schools were not fit, they were not qualified, they weren't providing quality education, they weren't doing what they should be doing as a medical school by the standards that was established by, the federal government. And so after that report, many medical schools closed. And there's only 5 of the remaining minority medical schools left after that report. So Howard University School of Medicine and Meharry Medical College were the only 2 that was believed to be worthy of survival. They still exist today. In 1978, though, the Morehouse School of Medicine was started in Atlanta, first only as a 2-year education program, and then evolved into a 4-year program in 1982, sorry. And then there was the Charles Drew University of Medicine and Science in California, which came to be, but it never gained independence for giving medical degrees, but it played a major part in the medical education, and it was called Charles Drew. The first minority medical association was the American Medical Association of Colored Physicians, Surgeons, Dentists, and Pharmacists. Now, this was established in 1895 in Atlanta, Georgia. So again, consistent with Black History Month, and consistent with why some people say, why do we need a Black History Month? Why does it need to be separate? Well, it's basically because we're not allowed to participate in the mainstream of white society. And so we had to start our own organizations, our own institutions. And of course, the federal government helped with that after the war. And they established the Freedmen's Bureau, which didn't last but so long, but that's some of the background. So in 1903, the name was changed to the National Medical Association, changed from the American Medical Association of Colored Physicians, Surgeons, Dentists, and Pharmacists. It was then changed to the National Medical Association. So Dr. Robert Fulton Boyd and Dr. Miles Link were the leading organizers of the association. So membership is made up of thousands of medical providers in the United States, Puerto Rico, and the US and Virgin Islands. And the first American medical journal was the National Medical and Surgical Observer, established in 1892. The Journal of the National Medical Association was first published in 1909 and is the oldest of any American African periodicals. So next, I want to talk about the African Americans who deserve special recognition. And I'm going to talk about them in part 2 because my time is about up today. So what you have so far is part 1 of the history of African American contribution to healthcare and medicine. Next time, we will talk about the African Americans who deserve special recognition, and that includes physicians, associations, health administrators, and others. So once again, I want to thank you for joining me today in this podcast, and always remember that your history and your health comes first. This is Dr. Richard Brown. Thank you.
This has been Your History and Health Starts First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.